You're listening to The Scope, a podcast dedicated to having open conversations about healthcare topics relevant to our patients and community. Today, we're talking about nutrition and diabetes. Let's get started. Hi, my name is Paul Hackbarth, and I will be co-hosting the Scope podcast with Paige Heitman moving forward. Today, our guest is Kim Richardson. She's a diabetes care and education specialist at Phelps Health. Welcome to the show.
Thanks for having me. I'm really excited to be here.
Yeah, so I guess I should say actually welcome back to the show. I know you did a Scope at Lunch a couple months back. So,
right.
We're glad to have you back with us. So to kick us off here, Kim, before we get into our topic today, why don't you just tell us a little bit about yourself and what you do here at Phelps Health?
So I've been a nurse for 22 years, which is hard to believe, almost half my life. And I've done lots of different things. I did critical care. I worked pre-op and recovery for surgery. I've done that for about 16 years, and I still do pick up shifts regularly with that. And then I've been a diabetic educator since September, I guess. And so it's so interesting how much variety there is in nursing, and it's fun because you can continue to grow and challenge yourself. And I am new to the area. We moved here in August of 20 because my husband grew up here and we wanted small town, and we just love it here, and we're so happy to be here.
Alrighty, so to get us started, can you give us just a brief overview? What is diabetes?
So diabetes is a metabolic disorder that makes it so people can't use sugar for energy well. So normally when we eat foods like carbohydrates, they turn into sugar in our body, and then that goes into our cells to help us do all the processes, like moving my hands while I'm talking, breathing, everything. And when someone has diabetes, either they don't have enough of the hormone insulin to get that sugar into the cells, or their bodies aren't letting the insulin do the work. So either way, you don't have that energy to do your normal activities in life.
Okay. And is that sort of the difference between, so there's type 1 diabetes and type 2 diabetes? Is that sort of the difference of how that insulin works?
Yes. So people with type 1 diabetes, it's typically that they don't make any insulin, or they don't make enough. And insulin is a hormone. It's just a key that opens the doors on the cells to let that sugar in. So if you don't have enough keys, then you're not getting that sugar in. And then type 2 diabetes typically means that it's called insulin resistance. So you can still have a decrease in insulin production, but most of the time it's that those keys aren't working. So my partner, Patty Cox, likes to say it's like putting your car key in your house lock. It just doesn't work. So either way, we're not getting that sugar into where it needs to go.
Okay. So I really like that metaphor about the key. Yeah. That's really cool. So, all right. So what effect does diabetes have on a person's everyday life?
So much. That's a great question because, and it can be very insidious. It just kind of creeps up on people. So typically, the majority of people who have diabetes have type 2 diabetes. And so that is, or what used to be called adult onset diabetes. And it can be very kind of sneaky in how it presents because a lot of the symptoms can be attributed to age because you can be really tired, you can have blurry vision, you just don't feel great, and sometimes increase in weight can cause insulin resistance, but it can also be a cause of, because if we're not using that sugar in our body wants to store it, so then it stores it as fat. So, putting on weight and feeling tired and, having this blurry vision and stuff is very easy to attribute to, I'm just getting older, this is just normal, I'm really busy, when it's actually something that we can treat. And a lot of people, when they start taking medication for diabetes, don't realize how bad they felt until they start feeling better, because it creeps up on you, and then all of a sudden they're like, I have energy, I can do things, I feel so much better. So it can be really life-changing.
Yeah, so that's awesome. So, and that's why it's so important to have these diabetes education like you, and to talk with your primary care, so that, like you said, you can start feeling a lot better. So for me, I mean, diabetes seems pretty common, because I think I read a statistic. It seems like about 1 in 10 people have diabetes. Does that seem about right? So
yeah, and it's I have to look here because I can't remember exactly, but you know, there's about 37 million people in the United States alone that have diabetes. But then there's also what's considered pre-diabetes, meaning you're kind of on that track where your blood sugar's a little higher and things. And that's, they think, is about 96 million. So it's extremely prevalent, and they've actually, because it is so prevalent in our society, the recommendation now is that they're starting to test people younger. So they're starting to look at blood sugars and things at age like 35 instead of 45, because if we can catch it sooner, then we can really help people long-term live their best life.
Okay. Yeah, that's great information. I love that. So, so you mentioned blood sugars earlier. How do different foods affect your blood sugar levels?
So all foods have some effect. But the majority of the foods that we eat, which are carbohydrates, so that's typically about around half of the foods we eat are considered carbohydrates. And those are foods that when we eat them, the majority of the nutrients that are digested is sugar. So the sugar goes into our bloodstream, and that's how our blood sugar goes up. And and we need those. You know, there's all these diets out there like keto and Atkins that, you know, nobody wants to eat carbs, or they may think, I have diabetes, so I can't eat carbs. But our brain likes carbs. That's the preferred energy source for our whole body. So it's finding ways to eat those carbohydrates in a way that we can use them well. So consistent, you know, proper portions, eat it with protein to help, because if we go out and just eat a donut, we know there's a lot of carbs in that, and that's really good. But if that's just what we have, our blood sugar can go up really fast because we can absorb those nutrients fast, but then we crash. And that's where, you know, you get that sugar crash, and that's why. So if we can eat the donut with maybe some cheese or a protein like meat or eggs or something, then that blood sugar doesn't go up as high, and we don't get the crash because we can actually use the sugar longer.
Awesome. Oh, well, that's really interesting. So I think that's a great segue sort of into our next question. So when talking about nutrition and diabetes, we often hear about the plate method. And this might be something I think you talk about in your education classes. Yes. Can you give us a little overview? What is the diabetes plate method?
So the when we talk about putting a meal together, you know, we want to have proper portions, because it's not just what we eat, but how much that we eat. So having those portion sizes correct is really important. So the idea with the plate method is to make it as simple as possible, but still be usable and appropriate. So the recommendation is a 9-inch plate. So, you know, not necessarily these big platters that some of us have. And you want half of it to be non-starchy vegetables. And what those are is like your salad greens, it's cucumbers, it's carrots, green beans, broccoli, all these things like that they don't have a lot of calories, so they don't have a lot of carbohydrates, but they have a lot of nutrients. So it gives us vitamins and minerals and good fiber. And so if half your plate is that, then you split the other half, and you want half to be protein. And leaner proteins are better because that helps with heart health and things. So, you know, chicken breasts or leaner cuts of beef or pork, or you can do eggs or, you know, plant-based protein like tofu or edamame. And then just that last quarter would be your carbohydrates, be that potatoes or rice or pasta or something like that.
Okay, so that's really interesting. Yeah, so it seems like diet plays a really important role in managing your diabetes. So can you kind of maybe tell us a little about what are maybe some foods that a person with diabetes can eat, and are there certain foods that maybe they should avoid or limit in their diet?
So that's a great question, because so many people come in and they're like, I feel like I can't eat anything.
Right.
And we always say there are no illegal foods. You can have everything in moderation in those proper portions, as long as, and paired with some protein. So, you can have a piece of cake or you can have some pasta. You just don't want to overdo it. And also we talk about a lot is there's that expectation we have to be perfect. If we're going to be successful, it has to be 100%. And that's not realistic. And that's why, and some of these diets are very, very, they almost set you up for failure because they're so restrictive. So we want to teach our participants how to eat in a way that can adapt to their lifestyle, to, different, vacation or anything, and still give them a way to meet their goals with their blood sugar. So one of the things we impress upon people is that if we can kind of follow that eating plan about 80% of the time, then that 20% won't have as big of an impact. So if we're trying to hit our goals for our meal plan, most of the time, then if we do go out and maybe we splurge because we're human,
right.
And it's good for us to have those things sometimes, then it's not going to be as big of a deal. So because diabetes is a metabolic problem, we know that it's something we have to work on all the time, but that doesn't mean that the expectation is you have to be perfect.
Okay, so like I said, I can still have that donut as
Yes.
long as I maybe balance it out with
Yes.
some other...
Yeah, maybe have a salad for lunch.
Okay.
And we always say that I like to say each meal is its own event. So you're not punishing yourself. Like, say you did have a donut and maybe you had two because they were really good. And, because food doesn't just feed our body, it's social, it's cultural, there's so many other meanings for food. So if you maybe did go overboard a little bit, it doesn't mean you should not eat. You should still have your meal and still feed your body, because our bodies aren't good at saving energy and using it later. We're kind of like a car that has a really small gas tank. So you go to the gas station and you fill your car, you can use that fuel in your gas tank. But when we overeat, it's like putting gas in gas cans and then putting it in the back seat. So we have the energy, but we can't really use it. So it's much better to kind of feed our body throughout the day, because that'll keep our energy levels much better.
Okay. So Kim, can you kind of explain, I know carb counting is something that is possibly brought up in some of these diabetes education classes that you guys have. What is carb counting? Can you explain that?
Sure. Carb counting is kind of a big thing that a lot of people do in other diets like keto and things like that. And so carb counting is a way to kind of spend your budget of your carbohydrates designated for each meal. So when we see a participant, we figure out a recommended calorie goal for a day using calculations based on body height and weight and things like that. And then we want to spread those carbohydrates out throughout a day. So we want really consistent carbohydrates, because that's going to give us that consistent energy. And for example, someone may have 45 grams of carbohydrates to have per meal. And one serving or one portion of carbohydrates is typically 15 grams. So you could have 3 servings or 3 choices of carbohydrates for your meal. And we have lots of data or lots of tables and information that we give people to help them figure that out. So say a 1/3 cup of rice is 15 grams of carbohydrates. So you could have some rice, but then you could also have an apple or some fruit or maybe some milk. And so it just gives you that flexibility to put your meal together in a way that's meaningful for you, and also meet those goals.
And you also said, I think, that there's apps that you can
Yes.
kind of use that to help track those as well?
Yeah, there's lots of apps out there that some you can take pictures of your meal and it'll give you an estimation of what your nutrients are in it. Others, like MyFitnessPal, is one that people will use, and they plug in all their foods, and that can tell them, how many calories and how many carbohydrates, how much protein, all those things. It can give you that information so you don't have to calculate it yourself. So the nice thing now is there is a lot of technology that can support and help us meet those health goals.
Yeah, so there's a lot of great resources out there that can help with that. So, okay. Let's switch gears a little bit and talk about fat. Can a person with diabetes eat fat, or should they avoid fat? What's your recommendation?
So we all need fat because it helps. It is a very concentrated source of energy, and there are certain vitamins that we can only absorb with fat. So it is essential, but we do know that there are certain types of fats that can be better for us to eat. So because diabetes affects our whole body, it can also affect our heart. And a lot of people who have diabetes also have high blood pressure, they may have heart problems. So we want to help support the entire body's health, including the cardiovascular system. So the recommendation is to eat more what are called monounsaturated fats, because they're better for our heart. And that would be things like nuts and avocados and lean meats and things like that. So it's okay to have a nice juicy steak once in a while, but because those fattier cuts of meat and things do have more what's called saturated fat, we know that can be harder on our heart and maybe not be as good for our body. So we want to try and eat more of the leaner cuts of meat and, add in those other, foods that are the monounsaturated fats, because those are better for us.
Okay, gotcha. So it's interesting. A lot of these recommendations, they're not only helping maybe you manage your diabetes, but they're helping, like you said, your heart health and lots of other different aspects of your well-being as well too. So,
definitely.
I want to also take a minute and talk about alcohol for a little bit. What effect does alcohol have on diabetes, and can someone with diabetes drink alcohol?
So it's a really interesting question, because people with diabetes can have alcohol, and again, moderation.
Right.
And we know that things like red wine can help with some of those nutrients in there that can actually help heart health and things like that. One of the interesting things about alcohol, though, is if someone with diabetes drinks an alcoholic beverage on an empty stomach, it can actually make them have low blood sugar up to the next day or even longer later. And the reason why is that our body can produce sugar, and it's by our liver. And our liver is also what helps us process alcohol. So if our body is busy, if the liver's busy processing the alcohol, and it gets this notification that our blood sugar is low and that it needs to add sugar, it's too busy over here processing the alcohol, so it can't help you out with that. So that's how it can cause that low blood sugar. And the interesting thing is, if we eat with it, the alcohol, if you have food, then that takes that risk away. So if you're going to have some wine, have some cheese, and that'll help balance that out.
So that's really cool. I didn't know that about how that affected the blood sugar levels. So that's good to know. So, all right. Can you talk a little about travel foods? What is some advice for people who have diabetes who maybe are traveling? So are there some good travel foods that they can bring with them, or what would you recommend?
And that's a great question, and that's something we talk about a lot in one of our classes, because not only travel can be anything from going on a vacation to the Grand Canyon or just going to St. Louis because you have an appointment or you want to go shopping or something. So many of our participants live in other towns. So even that, 30-minute drive is still travel, because you could get stuck. If you're on I-44 and there's a truck accident, you could be on the highway for 3 or 4 hours. So things like nuts or trail mix, you can get like protein bars or granola bars, things like that can withstand that heat. The temperature change is great. Always having water or an unsweetened beverage is really important, because hydration really helps us maintain a healthy blood sugar. And more, you will find that at convenience stores and gas stations, they do have better options for foods to eat. So you can find cheese, you can find hard-boiled eggs, you can find protein drinks, you can find a lot of things that can help give you maybe the protein that you need to go along with some of the other snack options. So and it's okay to have some chips if you want when you're on a trip, but add that protein in, and that's going to help keep that blood sugar more stable.
Yeah, that's great. And it also kind of goes back, like you said, moderation and just a variety of foods, I think really helps. So, yeah. To kind of wrap up here a little bit, in addition, I know you guys do education classes. You guys also do diabetes support groups. Can you talk a little bit about the diabetes support groups offered here at Phelps Health?
Sure. So last month was the first time we got to have support groups since COVID, so that was very exciting. And it's a way to connect with other people who have diabetes and give each other that support, because we know that diabetes isn't a sprint, it's a marathon. It's every day, and it's something we got to work on all the time, and that can be very exhausting. So finding that support with people who do understand is great. That I love that we're able to have that. And we hold it once a month. It's the second Tuesday of the month. It's from 4 to 5 p.m. at the Delbert Day Cancer Institute in the Shirley Day Conference Room C, D, and E. We're trying to work in the future with primary care providers, have them come to talk about kind of being a team with your physicians and your providers, because it's easy to say, oh, the doctor is the boss, but really, we are the boss of ourselves. We are the ones that are going to really affect that change, and we're the ones that can really make a difference in our life. So we want to empower people, and by coming to a support group, we kind of give them more tools to feel more confident about taking control of their health and taking care of themselves.
Yeah, so I love that part where you said that they are a team with your care team. So you're an important part of that. So so how can people with diabetes, if they want to learn more about diabetes education classes, how can they do that? Can they call you? Do they need to talk to their doctor? What's sort of the process for that? So
they're always welcome to call us. My number is 458-7697, and my partner Patty Cox, her number is 458-7314. We have voicemail, so if we are meeting with participants, you can always leave a message. Right now, you can have a referral sent over from your primary care provider, and then we would contact the person to get them scheduled. Right now, the referrals are only effective for people with diabetes. So we know that there's so many people with pre-diabetes, or maybe they don't have the insurance coverage, or their deductible's really high. So we also offer a free survival skills boot camp class once a month that can be, if someone wants to sign up for that, they can, and they can call us for that as well. So we really try to meet people where they're at in their life and still give them that support.
That's awesome. Yeah, and it's great. It's great. You guys have so many resources over there. So it's a lucky part. You're part of that community here. So, alrighty. Well, thanks for tuning into The Scope. If you liked our show and want to know more, check out phelpshealth.org.